Hello, my name is Dr. Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 14th of October, and it starts as a story of the hospital being very, very busy across the board with all manner of clinical conditions, but as also seeing a progressive rise in our COVID numbers. So today we're showing 82 COVID positive patients in our hospital, with 71 patients on our general wards in Blackpool Victoria Hospital, plus 5 in critical care and 6 patients at Clifton. That compares to the same report last week when we had 44. So that's pretty much a doubling in a week, and that's obviously very concerning. Now we're trying to maintain our clinical program as much as possible with our elective surgery, general surgery, cancer work, orthopedics, ENT, urology and so on. But clearly as we get busier, that other work is going to come under pressure. So we're anxious, of course, to keep as much of our general work going as possible. And the message that sits behind that is that if you're worried about any medical condition, we are still managing everything in that context. And of course your GP surgeries are still available to contact, and if you've got urgent enquiries, then I'd recommend that you use the NHS 111 system. We're showing 260 COVID related deaths, so that's deaths within 28 days of a COVID positive status. That's an increase of 9 on the data that we showed last week. So those messages around protecting ourselves, protecting each other, protecting patients are as important as ever. The guidance from the government is clear, and of course we may well see new restrictions coming in on the back of our data. We've seen the local population data progressively rise to in the region of 200 cases per 100,000, and we can see that the subset of that data shows that at least 20% of those positive swabs are in the over 60 age group. And since we know that age in itself is a risk factor for becoming poorly with COVID, it's really important to acknowledge that. We're seeing COVID positivity across the age ranges. It is not just a function of a younger population who are moving out and about. I've said before that now is the perfect time to get a flu jab if you're in the at-risk criteria. There is no circulating influenza at the moment, and if we can keep on top of that condition, that puts us, a whole population, in a much safer position to move into winter. And we are now undertaking a COVID vaccination study. We've already begun that with the hospital and one of the local GP surgeries, and if anybody's interested in being part of a COVID vaccine study, it's called Novavax. Then the details of how to get in touch with the team are on our website. So as the numbers have maintained very high and the hospital is under enormous pressure, we've had to maintain those visiting restrictions that I've talked about before. We don't like doing that. We're very uncomfortable about the fact that we're keeping loved ones from visiting, but we're doing that in the interests of patient safety and organisational safety. So finally, a fairly bleak picture, I think, today of numbers increasing of COVID positivity and general busyness across the health system. We're going to keep going, trying to do all aspects of healthcare. I'll keep you informed, but in the meantime, please stay safe and follow the guidance. Thank you.